In Style is sponsored by UConn Health. Here for you then, here for you now.
For many adults and older adults, joint replacement is necessary.
UConn Health has a new robotic technology for full joint replacements.
Orthopedic surgeon Dr. Olga Solovyova is joining us now to let us know about this new technology. Thank you for being with us.
Oh, thanks for having me.
Oh, it's our pleasure. All right, so how does someone know that they need a replacement? I guess that's first off.
Usually it kind of starts gradually as increased pain and stiffness in the knee, and the hip is usually in the groin. A lot of people actually think it's first a groin pull or a muscle pull, and then eventually it doesn't get better, and their primary care doctor will refer them to me. We'll get some x-rays and find out that they do have arthritis.
Okay, and what are the most common joints that you need to replace?
Hips and knees, far more than any other joints. There's about 1 million of hips and 1 million knees that are replaced every year.
Wow, that's really incredible. And is it because of physical or just normal living, or because we played sports or did something extracurricular back in our day?
Combination of everything, I think, kind of overuse, injuries to the joints in the past. People are living longer and more active lifestyles, so they're wearing out joints.
And it's important that people take care of these things, because falls are the number one reason that people visit the ER as an adult. So this can be kind of dangerous if you live on it too long, right?
Absolutely. You definitely want to get it looked at. Things like anti-inflammatory medications like Advil, ibuprofen, Motrin, those can help. Weight loss is really important in reducing the amount of pressure that's on the joints and helping that feel better, as well as regular kind of exercise and staying active. While it does potentially wear out joints, it's also important for keeping muscles strong and preventing the falls like you mentioned.
Yeah, and you guys have a new robot at there, right?
Yes. Yep. We just got a robot. We're going to start using it this week, and it helps us plan surgeries, especially for more complicated joint replacements. Say if someone's already had surgery on the hip or knee before, if they've broken a bone somewhere in their leg, that makes regular hip and knee replacement more challenging. But the robot helps plan that, make it more minimally invasive, and make it more accurate.
And people sometimes put this off because they're worried it's going to be painful or they're going to have to miss a lot of their life. But I know I've done interviews out there that this isn't often as bad as people think it's going to be.
Sure. Yeah, it's obviously surgery, so there is some pain afterward, but people do recover and get back to regular active lifestyle. I've had a couple of patients recently that have walked a couple miles within the first few weeks of the joint replacement.
Wow.
Those are a little bit unusual. That's better than even that I would expect. But usually within about a month or two, patients are usually feeling pretty good.
And how long can I expect the replacements to last? Will they last forever, or am I going to have to revisit this 20, 30 years down the line?
Unfortunately, probably not forever, but I think 20, 30 years is a reasonable expectation of how long you can expect the joint to last. The modern replacements that we've been doing for about the past 20 years have been lasting that long, but that's only how long we have data for. So it's hard to extrapolate that into the future to know exactly what sort of results we can expect.
That's some pretty good results, though.
Yeah. Keeps for a long time. And I know people say this, why did I wait so long? It's probably one of the most common comments because people start golfing again. Absolutely. Or doing things they enjoy, right?
Absolutely.
Well, thank you so much for your time. We wish you continued success.
Thanks for having me.
All right, for more information, you can go to health.uconn.edu.